Simple Guide to Direct Oral Anticoagulants. These agents act directly on parts of the clotting cascade to inhibit clot formation, unlike warfarin that acts through vitamin K. And they're indicated for the treatment of thromboembolism and the prevention of clots in atrial fibrillation and in patients who are having hip and knee replacement surgery to prevent DVTs. Currently, there are three agents on the Australian market: dabigatran, apixaban, and rivaroxaban. And unlike warfarin, they have set doses for the different indications and different populations, and you don't need to adjust the doses according to a result of something like a blood monitoring test. And their main adverse effects are simply bleeding. Let's take this up a level. The different agents vary because they have different methods of clearance from the body. So for example, dabigatran is mainly renally cleared. Dabigatran is also a bit different because it causes more gastrointestinal adverse effects because it has some local irritant effects. Unfortunately, because you can't measure the effect, you can't adjust the dose for patients who may not have been represented in the clinical trials. These might be those that are extremely old or thin or obese or frail. And that's essentially because you can't measure an anticoagulation effect. The other issue is that they're not easily reversible. Dabigatran does have an antidote, but this costs about $4,000 and it's hard to access. And they're also not suitable at all for patients with severe renal impairment. They're also not suitable for those patients where medication adherence is an issue. With warfarin, you can at least measure an INR to tell whether they're taking it or not. Whereas with these medications, you really have to take the patient's word. And if the patient's taking too few tablets and it doesn't work, or too many tablets, which causes a bleeding effect, you can never know.